my theory is that you have pre-existing tight nerve tunnels that aren't quite bad enough yet for you to have enough nerve damage that you have symptoms like burning, tingling, numbness, or jerking, or the other things that you are anxiousness. You have to get up and walk. All these symptoms that you can have with both restless legs and neuropathy. But once you had that vaccine and now you have damage to the nerve, that means that because of the damage, the nerves are speaking. They're now complaining. You've got the symptoms. Hey guys, Dr. Anderson, and I want to talk to you about the COVID vaccine and the fact that people are getting symptoms of restless legs and or neuropathy from the vaccine. Or maybe they had mild symptoms and then after the subsequent to the vaccine, their symptoms became worse. Some of our actually more popular YouTube videos are patients who've had successful reversal of these symptoms by opening up tight nerve tunnels in the lower extremity. I'm going to try to connect the dots, and it's primarily because one of our subscribers requested me to do this. So I might have had another video, but this is 2.0 version, trying to be a little more detailed about it, because I totally get how this could be a little bit confusing. And I must say in the beginning of this, just understand that I don't think we fully know all the things that may have happened with the vaccine in terms of side effects and such. You've heard about young men dying because of cardiac situations and things like that. But in the world of nerve, there's definitely evidence that it is causing some issues. When I see somebody with restless legs or neuropathy, I contend that more than not, these patients usually have tight nerve tunnels in the lower extremity, just like having carpal tunnel syndrome in the hands. And by opening up these tunnels, and 3 of them are in the leg and 2 of them are in the foot, we get rid of pressure on the nerve, and that then can make the nerve work more normal. I have to talk about something else here called axoplasmic flow, like the axon, axoplasmic flow. Axon is like a part of a nerve. When you have good normal nerve function, you are getting nutrients from the lower back in the area called the dorsal ganglion flow. Flow of nutrients goes down from your back. Think of it like a garden hose. Simple analogy. You're getting flow through the nerve down to the tip of your toe, and it's called antegrade flow, going away from the spinal cord down to the foot. And basically proteins are traveling down these microtubules. They're called a lot of technical terms I want to get into, but just understand real basic terms. There's flow of nutrients going down from the spinal cord to the nerves in the peripheral nervous system down towards the toes, and regarding the back, regarding the lower extremity. And then there's retrograde, meaning flow going the opposite way. So nutrients are created and carried with proteins down through the nerve. That's how the nerve is under constant repair. Our body needs constant repair, rejuvenating it, and then the flow goes the opposite way, which is called retrograde. So there could be toxins. There are things that need to be gotten rid of within the nerve. So there's this two-way flow, and that flow of nutrients has been negatively impacted when there's compression. So there's other things that can affect the health of the nerve, maybe oxygen, maybe nutrients, all these other things. But I'm just talking about the compression component, which is what I deal with. I'm opening up the nerve tunnel. The excessive compression is negative to the nerve, and one of the things that's really obvious is it's affecting the flow of nutrients down to the nerve and then back, and then toxins, let's say, going back up towards the spinal cord. So it's just like a garden hose. Think of it like that. Like you're opening up, you're getting rid of, like you're stepping on a garden hose. Less water comes out at the end, you release that pressure, more water goes down, and the nerves are happy, they're healthy, they're being repaired constantly. So that's what we do as surgeons. What happens when you have a COVID vaccine? Well, possibly. Again, I don't want to claim I know the total answer, but it probably in some way is toxic to nerve tissue. So you've now crossed this threshold. That's what I think. It's like the nerve may have already been under compression, but it wasn't bad enough that you started having nerve trauma or nerve death, if you will, mild nerve death. You know what I mean? So the nerve isn't speaking to you. The nerve isn't complaining to you. The nerve is fairly happy. It hasn't crossed that threshold. So my theory is that you have pre-existing tight nerve tunnels that aren't quite bad enough yet for you to have enough nerve damage that you have symptoms like burning, tingling, numbness, or jerking, or the other things that you are anxiousness. You have to get up and walk. All these symptoms that you can have with both restless legs and neuropathy. But once you had that vaccine and now you have damage to the nerve, that means that because of the damage, the nerves are speaking. They're now complaining. You've got the symptoms. So hopefully you understand that. It's kind of complicated, but it really isn't. And it might sound like kind of crazy and like, what are you talking about? And sometimes when you hear stuff like that, that's exactly where the truth lies. I just need to express that to you because nobody's talking about it. Hardly anybody's talking about the fact that you can open up tight nerve tunnels to get rid of restless legs and neuropathy. So how in the world would you expect them to be talking about nerve damage from COVID and the fact that maybe doing nerve decompression surgery can help that too? Well, we found that to be the case. We've had it help people that have come in. So very important distinction. I really appreciate you requesting this explanation. Kind of a long video, but hopefully you stay to the end of this because I think it might give you some answers as to where the connection lies between the vaccine and restless legs and neuropathy, because believe me, we're seeing it and a lot of you are having that issue. So again, please subscribe to our YouTube channel and please consider giving this to other people out there that you know that may have this mysterious problem with their nerves, and it all started with the COVID vaccine. So thank you for watching.